Okay, we're set.
Okay, please tell us your name and title.
My name is Michelle Sherman. I'm an HIV specialist pharmacist and president of Mishorex Pharmacist Consulting Services.
What are the unique challenges you face as a healthcare provider in getting patients to access healthcare in this region?
So the most difficult things that I have in getting patients to get access to healthcare is making sure that the patients know the resources that's available for them. I work predominantly with HIV patients here in the clinic, and it's very important that we get the message out so that patients know how to find the clinic and get access to care at this clinic and other clinics like this around Orange County.
Can you talk a little bit about delivering high quality care to this patient population?
With the work that I do with the clinic, I've been doing this work here at the clinic for 20 years now as a volunteer clinical pharmacist. So I work in the clinics as part of the team with the HIV doctors in providing services to the HIV patients within the community. So providing that care to the patients enables them to gain additional information about their drug therapies, information about drug interactions and side effects, and helps them manage their medications better, and also helps the provider to provide better services to the patient.
What are the ways you must cater service to effectively serve the unique communities in your territory?
So it's really important, a clinic like this, to work as a pharmacist in collaboration with a clinic like this community clinic. Can I just start this question again? Is that okay?
Yeah.
Sure, go ahead.
You'll cut that out, right?
Yeah,
Just
of course.
repeat the question.
So what are the ways you must cater service to effectively serve the unique communities in your territory?
So with HIV patients, it's very challenging that, first of all, they have access to the medications. And because of drug interactions and side effects that occur with the HIV antiretrovirals, it's really critical to have a clinical pharmacist on the patient's healthcare team to manage those issues when the doctor wants to prescribe things. So with our healthcare system the way it is, clients might come and see the provider in the clinic, but may need to be referred out to other specialists. So with the work that I do, the patients have access to me when they go and see other providers, and they prescribe other medications to manage those medications for these patients and for the providers here at the clinic.
How do you collaborate and collectively work to ensure successful care?
So since I've been working with the clinic for about 20 years now, we've really demonstrated very unique outcomes in the HIV patient population, especially those that I've been able to consult with, in managing side effects, drug interactions, even making referrals to other providers and other resources out in the community to effectively improve the patient outcomes and improve their quality of life. The goal of this program with the clinic and the HIV patients is to improve the patient's quality of life, and also have a resource and access for them to easily get to this clinic and get the services that are provided here.
Can you name one example of an advocacy effort that has succeeded and why?
Absolutely. So Laguna Beach was at the epicenter of the HIV epidemic ever since the early 80s. And the city of Laguna Beach actually has an HIV advisory committee that's a task force, a committee that's part of the city council. And the Laguna Beach Community Clinic has been extremely active on this committee ever since its inception in caring for HIV patients. So the clinic's been very successful every single year to be able to get resources and funding from the city of Laguna Beach to provide HIV services, and especially HIV testing, to the community at large here in the city of Laguna Beach, as well as many educational efforts on HIV to the community at large here in Laguna Beach.
Okay, this next question, do you mind rephrasing the question that I'm asking?
Okay.
So, what are the challenges posed by constantly having to advocate for funding despite consistently demonstrating value?
So the challenges with constantly fighting for funding and demonstrating value is a significant challenge, because as healthcare costs are ballooning out of control, it seems as if the funding is also dissipating, because there are more and more entities, there are more and more patients that are requiring funding. So it's very difficult to do that. But I think when you have effective programs and you can actually show real life outcomes to those programs, it makes getting those funding sources much better. And the services that I've been providing here at the clinic, the pharmacy services, we can demonstrate from those services that there has definitely been significant improvement in the outcomes for HIV clients receiving these consultation services.
How do you feel the community perceives your organization?
This community clinic has great standing within the community. It's based here in the middle of this big bustling beach community of Laguna Beach, where people think of the TV show and $1 million houses, and it provides critical services to the underserved community here in Laguna Beach and the surrounding communities. For the last 20 years I've been volunteering here, and the clinic is always full and very busy. So while people outside might perceive this image of Laguna Beach that they have in their mind, this location of this clinic is absolutely vital in providing life-sustaining services to the community here in Laguna and the surrounding areas.
What is your job and what type of patients do you serve?
So I'm a consulting pharmacist, a clinical pharmacist, providing advanced practice services in collaboration with the providers here in the clinic. So in California, pharmacists are recognized as healthcare providers providing these services. So in that collaboration, I provide services to the HIV community here at the clinic by reviewing all their medications, making sure they're appropriate, making any changes or recommending any changes to therapies as appropriate, and also as a conduit to community resources for these patients where they can access either additional care or psychosocial services or anything else they would need to have better outcomes.
What are politicians in Sacramento or Washington, D.C. missing about COCC and other community clinics consortia?
So I think it's very challenging for clinics like this and the coalition to demonstrate to politicians what the value is about the care that they provide directly to real people with boots on the ground. So being able to go and to promote the services that the clinic provides and to really show the politicians real life clinicians, providers, and real life patients excelling from the care that they've received in a clinic like this, I think is absolutely vital to continue the funding and hopefully improve funding to the clinics.
Last question. Please talk about COCC member clinics in terms of being a key partner in the community to deliver services to safety net populations.
I think that this consortium of clinics is absolutely vital in providing these services to the patients in the community. If these clinics didn't exist, the patients that come here would have to go to the emergency room. So these exorbitant healthcare costs that we have right now would skyrocket even further, and it would actually cripple economies in the various areas. So these clinics provide a vital source out in the community where patients can go and get top-notch care without having to go to an acute care center like the hospital, the ER, to be able to drain those resources from patients that really need it. And they can get taken care of here, have a place to go, and really exhibit good outcomes.
Is that it?
Yeah.
Good.
I really
Okay.
like that last answer. That's good.